Hi everyone, good evening, and I welcome you all for the seventh episode of PAX International Web Symposia. So today's topic will be something which is very international, internationally accepted, and being talked about in all of the hospitals and different, not only in medical field but also in different field. And the topic is work-life balance in pulmonology, and we'll be having a debate between our speakers, Dr. Arjun Khanna, who is the head of the department of Amrita Hospital, Faridabad, and to defend that, Dr. Pratibha Singhal is there with us, who is a consultant pulmonologist in Bombay Hospital and Sir H.N. Reliance Hospital. So this was one of the most talked about session, I would say, in PAX 2024, and we are going to relive this moment. And after that, we'll be having a question answer session. We'll be taking the audience question as well. And our international or national expert on this international topic will be Dr. Uma Maheshwari, who is a professor in St. John's Medical College and Hospital. And of course, Dr. Deepak Talwar sir will also be there to give his expert opinion in whatever views they both have. So without any delay, I would request the team to play the video of Dr. Arjun Khanna first.
Good evening, everyone. And one could only trust Dr. Talwar to give this kind of a topic and put our lives in greater difficulty than it already is. So, work-life balance in pulmonology, and I'll be talking about blame and blaming the hard workers because everyone wants it easy in life. And we were really debating and we were asking what this new work-life balance is and what this is and how is this relevant to our lives. Now, this is one of those topics where there are no papers, I cannot provide any evidence. So what I'll do is I'll speak from my heart and I'll tell you what I think of this work-life balance and what sense does it make to me. So I think that the maze of life, whatever we achieve in life, is this maze of life is the sum total of our destiny. No one can change our destiny, our karma. That is very important. How we treat others is going to reflect back on what happens to us eventually. And this fantastic term called WND, wants, needs and desires. Now, what is the difference between wants, needs and desires and how is it relevant to today's talk is what I would want to talk about. Now, wants is something that you need for everyday life. It's like dal chawal, it's like roti sabji, It's like a 9-to-5 job. You can do it, you cannot do it, you can punch in, you can escape. No one really, bothers. When along with dal chawal, you want something extra, you want raita, you want something more edible, you want something tastier, that is needs. And, at the end of it, along with that, when you want a dessert in life, that is desires. And everything in life, as you grow from wants, from needs to desires, I think it's a sum total of a lot of things. I think it's a function of time. As you grow older in life, as your experience grows, as you become older, things keep coming to you. And I keep telling this to my team that, don't worry if you don't have OPD patients, if you don't have IPD patients right now on your name, or if you are not being invited to talks. It is a function of time. It will happen to you sooner or later. It would depend a lot on your attitude. If your attitude in life is good, if you behave well with everyone, if you are nice with everyone, not toxic, I think it would happen to you. And I think the most important thing that makes you progress from wants to needs to desires and ultimately achieving them is your ability to dream big and to work harder. And I think this is paramount and this is amazingly important. There are certain deterrents to hard work and success. Some of them are uncontrollable. You cannot do anything about them. Bad luck, destiny, bad health, bad luck, lack of support. You cannot do anything about them. And that happens to you, it's fine. You can't really do anything about it. But there are a lot of controllable things. What are these controllable things that, prevent you from achieving what you can achieve in life? Laziness, procrastination, bad attitude, jealousy, insecurity, paying attention to what people are saying and cribbing all the time. And I think one of the biggest problems that today's generation faces is being woke. Now, this is a very new term which has come into being woke. And these are the people who talk about work-life balance. How do you identify people who are woke in life, and how do you, stay away from them? These people are usually from South Delhi, if you are working in Delhi, or like my opponent, where's Dr. Pratibha? They're from Sobo, which is South Bombay, and this is Dr. Pratibha's hospital in South Bombay. This slide has just been there. This picture I'm just showing. It has no connection to my opponent or my debater. I'm just showing as a matter of fact. These people are natural born protesters. Modi ji calls them Virodhi Jivi. Their life depends on Virod. Everything you do, they will Virod. They will have some kind of opposition. And when you talk to them on the bar, when there is whiskey around, they will say, no, we have gin and tonic. If at all, if they ever have whiskey, they will only have single malt. And they will have two, favorite phrases. They will talk about quality of life and they will talk about work-life balance. So if anyone in your vicinity is from this area of Delhi or Bombay, cannot say the term bhaiya properly, says bhaiya, and if they cannot have whiskey, if they like gin and tonic, and they talk about, quality of life, if they talk about work-life balance, you are absolutely sure that you have run into what is known as a woke person. And this woke person, unfortunately in today's era, wokeism is equivalent to toxicity. Why is that? I'll come to it. Now, this term that has been given to me, work-life balance. What is this work-life balance? When we were postgraduates, when we were DM residents, this term did not exist. We didn't have any, what is that? Rights or whatever that term is that kids talk about these days. Now, I think this work-life balance is a term which is a facade which has been coined by lazy people who don't really enjoy their work. I believe that work is the most important part of your life. How and why you should segregate it from the rest of your life, it totally depends on you. You can be absolutely woke, you can cry about it, you can crib about it, you can call it work-life balance. But all of you will agree that to earn, to sustain your lives, you need money, and for that you need work. Work-life balance can go to hell. You need money in your bank accounts, and that is important. And I always say, if you are able to do it well, if you are passionate about your work, if you love your work, your family will see it. They will adjust themselves accordingly. They will let you chase your dreams. And if your family sees that money is coming in, if this person who is the head of the family is enjoying their work, it is for their own good and they will support you in doing this. So what is this work-life balance? This is a new drama which has been coined by lazy people who don't want to work hard, yet they want all luxuries in life. So what do? Very easy. Blame the hard workers. Blame Deepak Talwar. Blame Arjun Khanna. Blame Randeep Guleria. I'm very happy. I am putting my name amongst these people. So, blame the hard workers. It makes no difference. And then say, these people have no work-life balance. Look at him. He's working every Sunday. He's just plain lucky. He has no work-life balance. To hell with your work-life balance. So, pulmonology and critical care, my dear friends, we are not radiologists, we are not pathologists, we are not microbiologists, we are not cosmetic dermatologists. If a person develops a pneumothorax at the 2 a.m. in night, I cannot say, sir, this is my work-life balance. I am very sorry. I will see your chest tube in the morning. It doesn't matter. It doesn't work that way. In pulmonology, critical care, you need to be on your toes. There is no room for errors. There is no room for laziness here. Don't put a chest tube in a pneumothorax. What happens? Nothing. The patient dies. You go to court. End of work-life balance. End of everything. You need to be available for your patients 24/7. And this is the rule. You cannot do anything about it. इतना रोना था तो skin ले लेते थे. क्यों ली derma? क्यों ली pulmonology? Don't take these branches. Hard work, unfortunately, and this is new term. Apart from this work-life balance, this new term, toxicity. When we were PGs, at KGMC Lucknow, chairperson is my senior and the judge is my junior, both from KGMC. We are all from the same college. भैया हमारे यहाँ ये टॉक्सिसिटी, वर्क लाइफ बैलेंस, केजीएमसी में ये सब टर्म्स कब से आनी शुरू हो गई? कभी सुनी थी वहाँ पे? हमारे यहाँ ये सब नहीं होता. हमारे यहाँ एक टर्म होती है, वो होती है चरस. और चरस पे बीतती है जिंदगी. और अगर चरस ना होती तो आज हम तीनों स्टेज पे नहीं होते. अगर हम तीनों ने वर्क लाइफ बैलेंस किया होता तो शायद यहाँ ना होते, प्राइमरी हेल्थ सेंटर बाराबंकी में होते. सो हार्ड वर्क इज नॉट टॉक्सिसिटी. Sweet darlings, little PGs, stop being so delicate. Stop being offended by everything. यार हर चीज का इतना बुरा क्यों लग जाता है? What is this new drama, toxicity, work-life balance? And this is exactly why 10 years after where I started, I can sit, alongside with this man and I can face the world. So my work, this talk is not for consultants. This talk is for all the PGs and all the kids and the SRs and the residents and kids, who are there. Make work a part of your life. It is the most important part of your life. This is what you earn your livelihood from. You studied so hard. इतने साल पढ़ाई क्यों करी थी? कमाने के लिए करी थी ना? Keep your buzzer silent. So, and just give me 2 minutes. So, the work is the most important part of your life and everything else can be planned around work. The best way is your work family should be as important as your home family, and that is why, both your families can coexist happily. And when you talk about work families, your juniors, your residents, your colleagues, your PGs, your friends, to go up, you don't really need to pull down people. It is the best to grow together as a team. Something that, I put there, be unapologetically extreme. Be a try-hard, be a gym rat, be a workaholic. Let them call you obsessed, let it be. At first, they'll ask you why, and then they'll ask you how. But they'll never understand, for some, the work is reward. A 3-hour gym session, early morning marathon, staying up till 4 a.m., editing your writing, making your PPTs. The things that give you pain are also the things that give you purpose in life. And I think that is the most important thing in life. Work isn't something that you try to fit into your life. It is your life. It is your end goal to be relentless, and the hunt is the feast. So be a hunter, keep hunting. It is about finding your balance, Please do not blame the people who work hard. And just to sum up, काम ही मेरी पूजा है और पूजा ही मेरा काम है. मेरी बीवी का नाम भी पूजा है. So this is exactly what I mean by it. And thank you so much.
What a tremendous lecture by Dr. Arjun Khanna, I must say. And I still remember there were a lot of claps happening around. All the audience went crazy, and I was one of them too. And I never thought that anyone in this whole world can, match up to the standards of this lecture. And I think, Dr. Talwar sir, I request you to just give your comments about this lecture which Dr. Arjun has just given, and what are your views? How do you think? About his views? Yeah.
Kanishk, it's a deja vu for me actually. I can't remember the entire hall full of 1,000 people with the thundering going on after Arjun finished. And my heart was beating so fast that what Pratibha is going to do and how is Pratibha going to defend everything. And I think I will just leave it to you, because it's amazing the way Pratibha has done. So I think we should see how the Pratibha has given her viewpoint and so brilliantly delivered it, that it really made us think that, what is this work-life balance, which was 35 or 40 years ago when I and Randeep were working at PGI, and how is it today? So in fact, both of us were discussing that how the 40 years have completely changed the medicine and how we work and how are we expected to work. So I think let's see, and then we can go to Uma to see that, because I think Uma wasn't there on that day, so she would have got a different opinion about it. But I think Pratibha, let's hear out Pratibha also on this.
So let's play Dr. Pratibha's video.
So at the outset, I think Arjun has got the topic wrong, because his last and second last slide actually said exactly what I'm going to say. I think for him, work-life balance, in his second last slide, he said there is a work family and there is a home family. That is exactly what is work-life balance. We are not talking about maintaining a balance between work and home. We are talking about overworking, where you're going to burn out, where you're going to have other mental issues. You're not going to be able to continue working because you're so burnt out, you're anxious, you're making mistakes at work. Your last slide said something about being able to gym, being able to do marathon, and that is also work-life balance. And that is what you're choosing. So I think your entire presentation was focusing on actually having a work-life balance, choosing a work-life balance. What you should have focused upon was, I don't have any time to go to the gym, I don't have any time to do anything, I don't have any time to socialize at work, I'm only seeing patients when my patients are my life. That's not what we are talking about. The second thing is, you said there are no studies on work-life balance. I'm so sorry. I need to enlighten you. There is so much data on why work-life balance is important. And then let's start with this wonderful quote by Sadhguru saying that there is no such thing as work-life balance. It is all life. Basically, life is what is a work-life balance, and the balance has to be within you. Why do we need to talk about this? So Indians spend most of their time at work. This is actual data, okay? We are talking data, we are not talking my experience. Being too busy has become a status symbol in India, okay? Somebody calls you up and says, hey, are you free? Oh, I'm too busy. I have no time. I have to be at work. So what happens when you're trying to be too busy? You're overworking, you have unrealistic deadlines that you set for yourself, okay? Some of us are also have the misfortune to that, going for conferences every weekend, having to have a talk at every meeting, not being able to say no, then having competition. Oh, that person did so many interventions. I have done only 2 interventions this week. That's when you land up isolating yourself from your friends, because you start competing with your friends, and that's not what you want to do. Then, of course, you have other gender-related issues. What are the issues that we face as pulmonologists when you're doing interventions? You've done a difficult procedure, you've tried something new, and you're just worried about, oh, is he going to be fine? If the patient goes on ventilator after a procedure, is he going to come out of the ventilator? What do you tell the relatives? And of course, for most of us, breaking bad news is the most difficult task. When we are talking about work-life balance, we are not talking about that you should not work, okay? We are talking about maintaining a balance, that you are not stressed about it. You don't take your stress back home. What happens when you have stress related to work? You have poor sleep, you're not alert, you make mistakes at work, your actual productivity at work goes down, you become anxious, you become disorganized at work. So when you're overworking, you're actually giving stress to your own self. But remember, not all stress is bad, okay? There are some stresses which are important. Stress is there for how we deal with stress is also important. And you cannot have a generic advice for stress. I'm sorry if Arjun is not able to deal with excess stress. Maybe some of the PGs out there are not able to deal with that much stress, and we should not blame them for that. What is the evidence on stress? Okay, there is Indian data which says that private medical practitioners in Vellore, out of the 335 respondents, 35% had high job stress, 36% had moderate job stress. So all of them were stressed at some level, low, moderate or severe. So there was nobody who was not stressed. This is pulmonologists, okay, before COVID. Look at pulmonary medicine was at the 89th percentile of being happy, not having stress. Now look at what it is now. This is data in the last 4 years. We are at 59%. Okay, we've come to the middle level. And we're still talking about not wanting to deal with it and say, oh, all is hunky-dory and we're so happy because we only have a work life. Now look at Arjun's slides. He's talking about work-life balance, and there are only pictures of people at work. What happens to people at home? You don't have time to take pictures with them, is it? So problem of must and should, okay? This is what it basically comes down to. I must do great in practice, otherwise I'm not a good doctor. I must become head of department at the age of 40, otherwise I'm useless. Patients must follow the advice I give them, otherwise I'm useless. My spouse should always understand when I come home tired. I think Pooja must be understanding that. My child must behave the way I want him to, or I behave with my parents. And people should treat me the way I want them to, otherwise, oh, there's a problem. So remember, it's all about expectations, what your expectations are and whether you're able to achieve them. There are these 3 musts that you must not do. I must do well, you must treat me well, and the world must be easy for me. Remember, this is what is going to lead to your downfall. And eventually, it is all in the mind. Perception is the key. Man is affected not by events, but by the view you take of them. So there is a definition for work-life balance. Arjun, please look at this carefully. Work-life balance is the individual perception that work and non-work activities are compatible and promote growth in accordance with an individual's current life priorities, which means it is a continuous change. What I think as priority today may not be priority tomorrow. And forgive me, but I have about 10 years worth more life experience than you. And I know for a fact that today work alone is not my priority. What are your flags of work-life imbalance? Not getting enough sleep. How much do you sleep, Arjun, every day? Do you get enough sleep? If you're 3 hours in the gym, I'm sure you're not sleeping enough. Feeling fatigued all the time. Missing out family events. How many family events has Arjun missed out? Working on a holiday. Do you work on a holiday? Ignoring health. If you don't have time for a health checkup, you're definitely not having a work-life balance. So how do we get this balance? For the young people out there, set boundaries, okay? You know your limitations, set boundaries. You have a work time, you have a family time. I'm not saying you slack from work. For all the PGs out there, this is not a promotional talk for you to say, oh, we have only 6 hours duty, the rest of it we have to take off. No, that is not what I'm saying. I'm saying you must work hard, but you also must realize when you're stressed, when you're fatigued, and that is when you need to take time off. Set boundaries for your family time. Remember, binge watching online content after a hard day of work is not de-stressing, and this is data. Follow a schedule, not just for your work, but also for your family life. Schedule your family events in advance in your calendar so that you are obviously going to make time for them. Outsource whatever you can do. Sonam, who's a dear friend of mine, recently told me, buy your happiness. I was struggling with some maid situations at home, and she just told me this wonderful thing, buy your happiness. So all those people out there who need to make more time, buy your happiness. Outsource things that you need to do. Spend 20% of your work time doing something that you love. Remember, Steve Jobs said that if you love what you do, it will not feel like work. Take your vacation. Don't forget, there is a study which says taking 4 vacations in a year is what is ideal. Some of us may not have the luxury to do that all the time, but remember, we go to conferences in lovely locations all the time. Take 2 days off after the conference. Late Dr. A.C. Shah, who just passed away and who was my teacher and mentor, always followed that mantra. Every BronchoCon, he and Dr. S.P. Shah would take few days off after the conference, and they have such lovely memories that they have built together. Look after yourself. Of course, Arjun is doing that. I mean, look at him, he's very fit. Go to the gym, meditate, eat healthy, and follow the 80-20 rule. Apply the Pareto principle by focusing on 20% of the tasks that will yield 80% of the results. What do pulmonologists do? This is an actual study to de-stress. Spend time with family and friends. 83% of them believe in doing that. This is real data. Arjun, please listen to this. Exercise. 70% believe in exercising. Develop a hobby, whatever it is. Get some more sleep, eat healthy. And of course, in India, it is still stigmatic to say that I need therapy, but it's okay. If you are needing therapy, it's fine. You do reach out to people. So what we teach and ask our patients to follow, we must follow ourselves. So many times our patients come and say, doctor, I'm not getting sleep. What do we tell them? Oh, do some meditation, do some breathing exercises. We don't do it ourselves. It is a great de-stressor. And of course, now this debate. Is it really a fair debate? Okay, why? So what happens, Arjun? Do you know when the groceries are ordered at home? No, you are only at work. Do you look after your child? Do you go to his school meetings? Do you go to the annual concerts? So if you're making time for that, then this whole debate is only flawed. That means what you projected in your slide was wrong, because women have to do so much more. There is data that says the risk of female pulmonary physicians developing burnout was 1.7 times higher. Other surveys have said that female physicians have 20 to 60% higher burnout rates because they have gender-specific challenges in their work. They have limited childbearing years and are the main caregivers for children. I'm sure there are many more men in the audience than women, but I'm sure all of you all keep a hand to your heart and say how much of your child's education have you really contributed to and how much has your wife. They also receive fewer opportunities for promotion to leadership positions, and still, even in the West, they encounter unequal pay. And therefore, more work-related stresses and less control over their working environment. And therefore, your life is a result of the choices you make. If you don't like your life, it is time to start making better choices. And coming back to Sadhguru, when you know the possibilities and limitations of every aspect of life, wisdom and balance arises. Arjun is young. Right now, he thinks that work is his only life. But when you grow older, you will realize that those patients are not going to come to you and stand by you when you need them for help. Your family, your friends, your relatives will do that. People you have nurtured relationships will do that. So
You're not audible. Kanishk, you are not audible.
Oh, I'm sorry. So it was a perfect reply in my point of view. Dr. Uma Maheshwari, I would like to know what do you think about Dr. Pratibha's comeback lecture?
Is there a rebuttal allowed now?
Yeah, I will give you the chance definitely. Last time you didn't got.
Yeah, that was nice conversation, and paradoxically, this is happening on the weekend where work-life balance issues rise for all of us. And as we speak, I'm missing a family event to do this. So anyway, I think first of all, great job to both the speakers, and I wish what this would have been if the tables had been turned. For example, if Pratibha had spoken against it and Arjun had spoken for it. Intuitively, it's easier for women to speak about work-life balance simply because of the many roles that we say. I'm not underplaying the role of family or men. I wouldn't be where I am without my family, without the support. So that support is a big thing which plays a big role, and your family understanding what you're trying to do, and that hill is higher to climb for women when it comes to men. Again, I'm not underplaying the role of men, and I think most of us here in modern India do understand that the necessity for a woman to have her identity, to have a work, to have to be proud of what she's doing and not just be an ancillary breadwinner. So hats off to both of you. I wish you could reverse roles and speak about it.
So, Dr. Arjun, you are talking about the rebuttal. We have, I think, 3-4 minutes maybe.
Yeah, I don't need 3-4 minutes.
Yeah.
Few of the slides from the presentation, the most important ones were missing. So I think the recording was not proper. So, the most important slides were missing. And what I wanted to actually say that day, mic was taken away from me. The last slide, Pratibha ma'am's last slide has not been shown. Her last slide was, next month is the VASOG conference. I welcome all of you to attend the VASOG conference in Agra. Now look at her. Now she's asking you to not work, and at the end of it, the next presentation is, the last slide of the presentation is, I welcome you to the VASOG conference, which I am the, the organizing chairperson, and all of you must attend the VASOG conference. And after the talk, she actually went around, in the audience, and she also invited us, to attend the VASOG conference. Now, this is not fair. This is being paradoxical. You give a talk on why work-life balance is so important. And on the other hand, VASOG conference for 3 days, she wanted us to miss 3 days of family life and come to Agra. So, ma'am, this is not fair. This presentation, the video recording is not fair. The last slide has not been shown. Uma, ma'am, you should have been there. It just fizzled out. The whole thing, whatever she said, just fizzled out in the end. And unfortunately, Dr. Talwar and Kanishk have not shown those slides. That was the end of all discussion. You talk about work-life balance and you invite everyone to a conference. Not fair.
In fact, I think you didn't listen to my presentation very well, Arjun, because those slides, in fact, I also was wondering why some of the slides are missing. And I did say very clearly that for a short period, our work-life balance is going to be more towards work rather than life. But if you realize, my definition of work-life balance, right? It said it changes from time to time.
So when you need to win, it changes. Then it's
yes. Also,
Yeah, but Arjun, let me interrupt. Arjun and Dr. Pratibha,
yes.
some debates are not meant to be won. It is for us to realize and come to a middle path. I don't believe in winning a debate. It's about putting things into perspective, and obviously there is a difference in perception with respect to which gender you belong to. And not all of us are fortunate like Pratibha and me. A lot of them have to face a lot of flack for putting work ahead of their family life.
So before I start asking a few questions, direct question according to the lecture which you have taken, Dr. Arjun and Dr. Pratibha, I want Dr. Talwar sir to say something because now he has listened to again the both of them what he has to say in the rebuttal as well.
So some of the things which are missing, Arjun, there primarily because I think this is the recording which was archived, and maybe there were some of the things which were in which the audio was not correct. So maybe that was the reason it's not there. But I think in a sense that whatever was discussed, in the end, I think it is more or less that it was fun watching that, this subject has come on platform where we are talking about it. Actually, there is a platform to talk about it, and more than I would say 10 times more appreciation was from the international faculty that they are not able to talk about this which you people are talking about, and it is the truth of life actually. So I was like, that we are actually treading into some area which was little difficult, definitely, but you two made a big impact on it. And in fact, as Uma said, it's not a question of who wins or who loses. Actually, you both were the winners. You both were the winners. And the witness, I don't have that picture to show you, the witness of 1,000 people cheering you at the end of the debate. And I have just small submission because I might leave a little early. Dear friends, all of you who are watching this, PAX 2025 Octane, the miracle is going to happen again. Arjun Khanna and Pratibha Singhal are going to fight again. Both of them don't know about it because I am the one who's declaring it. And they are going to talk about gender equity in pulmonary medicine, which is again going to be a very, very difficult subject. Arjun has been asking me, what is the topic? I am giving you, Arjun, right now. Gender equity in pulmonary medicine. We need it or we don't need it. We talk about it or we don't talk about it. And I think we are really going to enjoy that. With that, I will say, Pratibha, you and Arjun both get ready because the entire team is ready to see that what miracle it is going to talk about, because this is again something which we do not talk about actually. We really need to talk about it and come to something. So with that, I will thank Arjun and Pratibha as well as Uma for giving her time to us. I know, Uma, how busy you are, and I really wish that, we talk something which is really very important for the mental health of all of us, and it should also keep us steer into a situation where we know actually this work which we have done of years of hard work should not also go away. It should not go away also. And obviously to preserve this, we need to have a balance, and I think that's such kind of debates have brought it. So back to you, Kanishk.
Thank you, sir. So I'll start with some questions. My first question will be to Dr. Arjun. So you said work is life and family should support it and understand it maybe. But in hindsight, do you think this view may lead to unsustainable practices or fatigue in pulmonary medicine?
No, I don't think so. Absolutely. I don't agree with that. And I think it is about finding your balance and, debates apart. Unfortunately, life is such that you have to be good at whatever you do. You have to be good at work. You have to be good at family life. And no one is forcing upon you to sit in the hospital 24 hours a day. No one is forcing you to do that. It's the end of it, at the end of it, it's what you want in life. And that would happen. Everyone wants to be on the cover of the Time magazine. But when Narayan Murthy said that you need to work 70 hours a day to be on the cover of Time magazine, then people had a lot of problem about it. So if you don't want to be on the cover of the Time magazine, it's fine. It's absolutely fine to set your own boundaries. And in those boundaries, you know how to please your family. In those boundaries, you know how to do your work well.
So to everyone their own. If your luck is such, if God has blessed you with such a family that they understand that you need to be good at your work, or sometimes you need to be extreme at your work to be happy and to keep them happy, then it's your luck, and to each their own. I don't agree with that, Kanishk. I don't agree with that at all. A lot of times when it comes to work-life balance, unfortunately, the whole, the angle of gender and all these things, come into it. And I absolutely understand that. I am the father of a daughter, a teenage daughter. I have sisters, and I understand where that comes from. I absolutely understand that. But I think at the end of it all comes down to what you want in life. There is absolutely no dearth of successful people in life who have good families or who have successful family lives as well. So no, I don't agree with what you just said.
Okay. So moving on, I will give Dr. Uma Maheshwari ma'am to give the final conclusion about after each questions being asked to the contenders. Now the question to Dr. Pratibha is, Dr. Pratibha, you strongly defended work-life balance, but how do you respond to the argument that medicine is a calling and patients don't follow your schedule? Also, do you think a healthy competition is necessary for one's growth? Because you said that this guy did four procedures and I did only one. I need to, don't you think the healthy competition is also necessary? And, medicine is a calling and patient will not follow your schedule. What do you want to say about this?
So, both great questions. Firstly, I think I want to just add to something that happened at the end of this entire debate was, we had more men in the audience for sure. And a lot of them really thought about how much their better halves were managing at home when they were working and managing house. So I think that is basically what we are talking about is even if 10 of those men felt that they need to be more involved in their home life, I think that is what, that was what my talk achieved. Coming to your question now is that yes, medicine is a calling. It doesn't, patients don't have, we are not talking about emergencies here. Okay. So Arjun had made a statement about a pneumothorax coming in the middle of the night. I am not saying you tell that patient, I will put a tube tomorrow morning because I am busy right now. No, that's not what I'm saying. I'm talking about scheduling work on a routine basis, which can be postponed. If you have other things to do, like spend time with family, there are other social commitments related to family and friends, you should make time out for them. I'm not saying you go for every commitment with social commitment, but the important ones, yes. I've seen doctors who are not present for any of their family events, quoting that they are busy with their patients. That is what I'm trying to say. I'm not saying that today you say, okay, fine, my patient is having a pneumothorax, requires an emergency ICU scopy, I don't go for it. No, I'm not saying that. Or there is an ICU admission, I'm not saying you don't go for that. But yes, you don't use only work as an excuse to not be available for anybody else. That's what I'm saying. And about healthy competition, you said the exact word, healthy competition, right? So that word itself says healthy competition is always good, but unhealthy competition, which brings in stress, anxiety, jealousy, that is when there is a problem. So I'm talking about unhealthy competition. I'm not talking about healthy competition, right? Okay. And of course, my parameters of being happy and having a healthy competition versus somebody else's parameters may be completely different. And that is the crux of that talk said that work-life balance is a very individual thing for every person, right? But if my parameters are making me happy, I'm fine. But if somebody else's parameters are making them stressed, that is when they're not having a good work-life balance. That is what I'm saying.
Yeah, Dr. Uma, ma'am, Dr. Arjun meant, I think that, if you want to be on the cover magazine, then you have to work hard, which is the reality. You have to work hard, harder than everybody else to be on the top. And Dr. Pratibha meant to say that, yes, medicine is a calling, but, there are, teamwork and hours, divided, and people are doing their job at their assigned time, and there should be a healthy competition, not an unhealthy competition. So what do you want to say about that? Both of them are right on their part.
Both are right in a way. What I want to emphasize is medicine is a calling, medicine is a marathon, it's not a race. So you don't have to race with anyone. And like Arjun said, there is no room for, you can't cut any slack when it comes to your patients. And when we are talking of work life balance, we are not talking about time of the day. We have long given it up. We have given up our circadian rhythms, we have given up our personal life to train. So, all of us, regardless of gender, are aware. It is part of our DNA. So, there is no question of saying work life balance when you have to attend to an emergency. At the same time, when you talk of balance, it's again inner balance, your needs, and how you want to balance it. For instance, I would like to attend every conference, every event. I would love to attend PAX every year. But if something else comes up, let's say on my professional front or personal front, then I have to prioritize. This is when we have to talk about, the famous author Stephen Covey, who talks about the four quadrants: the Q1, Q2, Q3, Q4. The most urgent, most important deserve attention, and Q1 is not always work all the time. Sometimes it's also your personal life. So once you're able to put your tasks into that particular basket, is it urgent, important, urgent, not important? Most of the time, we are spending time on urgent, not important. All of us are doing doom scrolling these days. And when it comes to something else, we'll say, okay, we don't have time to do it. So it's about prioritizing, and priorities keep getting realigned throughout your life.
So moving
So,
to the
yeah,
next
yeah.
question to Dr. Arjun, I have like two, three questions. So I request both of you to keep everything very short and crisp. So my next question to you is about your comment about woke and lazy doctors. So do you think this can be a discouraging thing, or discourages open conversation about mental health among doctors?
Oh, no, no, no. So being woke and everyone has become. I think it's I'll make a very controversial statement, Kanish. And a lot of you will disagree with it on the camera, but all of you will agree with it. Things are changing, and these days, life is very different. And these days, for example, in MBBS, no ragging is allowed, and you cannot interact with your juniors. You cannot call a person who's obese because it will hurt them. You cannot, you'll have to be, you'll have to find the politically correct answer or a view out of everything, because आजकल लोग hurt बहुत जल्दी हो जाते हैं, because this is a very very Western concept. So I kind of, I believe in wearing my heart on my sleeve. And the problem why this whole debate came up, Kanish, was that, I unfortunately that part of the debate, the first few slides of mine got missed out today. This was on the New Year party where me and Dr. Talwar were sitting together and we were discussing how residents have changed. Our times, I'm not saying that working hard is bad, or we were overworked and that was amazing, and everyone needs to be overworked and being made to slog like donkeys. No, we don't want that in life. But there was this respect for seniors. We knew we had to get the work done, and we knew there were no excuses out of it. Now, when there are 20 sick patients in the ward, and the resident comes and tells you that my 6 hours of duty are over, and as per the NMC norms, I am not going to work more than this because my work-life balance gets affected. When we were MD, DM residents, where was this? I think there comes a phase in life where all these phrases and terms become important. As a consultant, because I probably have a certain luxury in life now, I have my knowledge base now, I can afford to work on my own terms. The whole debate stemmed from a time where junior consultants, where people who had just passed out their PGs or people who were doing their PGs, would come up to you and tell you that it's 5 o'clock and I need to go home now, boss. I'm not going to work more because my DNB, this thing, the pro forma that I filled, or the syllabus says that I'm not supposed to work beyond this. This is where this whole debate stemmed from. We were not debating against men versus women. There were no Miss Universe winning answers here that, that women are being overworked. This is unfortunately the part of the debate that got lost in transition, that was not, unfortunately translated today. So this message was basically for all the residents who were trying to cut slack, that 6 hours a day is what we will work, because this is what the NMC rule says. Boss, medicine doesn't work this way.
So
And
should dismiss it as a weakness if somebody
I
say,
think you should. Yeah, yeah, absolutely you should. There is absolutely no harm in calling a fat person a fat person. And if you ask them to lose weight, it's for their own good. Why do you have to be politically correct about everything? This is what I don't understand in today's world. And you can call me blunt, but this is the way it is. A fat person is a fat person. You ask them to lose weight, it's for their own good. No, why can't you scold a PG who doesn't want to work hard in the ward? What's wrong with that, Kanishk?
no, no, I absolutely agree with you. But I think it's actually a very controversial question. But you have given your honest viewpoint, and I think to a greatest extent, I would say that you are absolutely right. And we have to, then we have to. There is nothing like the time is over, or I won't be doing that because there is 5 p.m. or 6 p.m. and I have to go to take care of my mental health. That's also what I think. But moving on to Dr. Pratibha ma'am, your next question is very, very important. I think many young doctors fear that if they set boundaries, that as Dr. Arjun was also saying that 5 बज के मुझे जाना है, many young doctors fear that if they set boundaries, they will lose career opportunities because senior like Dr. Arjun Khanna will be very sad, or even me will be very sad that he is leaving. What is your advice for balancing ambition with well-being?
So see, I think the premise of this whole thing is only wrong. We are not talking about PGs, not finishing their job and giving the example of, oh, it's 5 o'clock, my duty time is over, I should go. We are not talking about that. Okay. We are talking about more of the fact that when there is work, you need to do work. But when there is a possibility of taking a break, there are people who don't take a break and continue to keep working and suffer mentally. That is what I'm trying to say. I'm not saying that people who are, when you're talking now, this specific question that you asked about young pulmonologists, right? So,
Yeah.
as I said and as I quoted, it is what you want from life and what is your expectation out of yourself, right?
Don't you think, I mean, I meant to say that suppose you go to a hospital, you start working under someone, and you set your boundaries at that point of time. Of course, when you
No,
are
if
head,
you're working with someone and under someone, your boundaries cannot always be set only by you. It has to be then set by what the
because
what the
I'm
institute and the department demands of you, right? You can set your boundaries when you're your own person and your own individual person.
so
What
I'm
I'm
just
trying to say is that you see a lot of doctors who start work at 9 o'clock in the morning and go home at 12 o'clock at night. That is probably not healthy for them in the long term. And again, coming back to what Arjun is saying, maybe Arjun will think differently 10 years hence when he's as old as I am.
we'll see what Dr. Arjun has
We
to
should
say.
have this conversation again then.
We'll have over a coffee, definitely.
Yes. Yes.
So, Dr. Arjun, again to you. You clearly love your work by whatever you have said and shown in the slides. But is there a line where passion can turn into obsession? And how do you personally identify that line and maintain that?
I don't know, Kanishk. I don't know these fancy words. This is a very, very beauty pageant winning answer. I absolutely don't know the answer to that. I think you need to work hard. That's all I know. And it's I think every normal human being would kind of know their own boundaries as to when it is getting pathological and when it is getting abnormal. It's at the end of it how successful you want to be in life. Where do you see yourself in life, and where do you place yourself in life?
So,
If I have set goals for myself career wise, that does not mean that I cannot have goals as a father. I cannot have goals as a husband or as a son. And I cannot perform well as a husband or a son or as a father just because I have goals at work. I think it's about, the whole pretense of this talk was finding your inner being, but not cutting slack. I don't know where those boundaries come in. For every person, they are going to be different. For me, for Dr. Pratibha, for you, for Uma ma'am, for Deepak Talwar sir, it's going to be different. We all know our respective boundaries. Just because, I want to work hard at work does not make me a bad husband or a bad father. So no. These kind of life is always shades of gray. There is no black or white in life, and one has to find their inner balance. Of course, I think over a period of time, medicine, as ma'am said, it's a marathon. It's a difficult profession to pursue. And of all the people in the world, we really need to take care of our mental health because we are probably the worst hit by all of it. And those 10 minutes of silence, for example, for me, my half hour of jogging in the morning, or those 15 minutes of 20 minutes of weight training at the gym, or just having a cup of coffee with my team where we all laugh out loud, is what is de-stressing for me. So I think everyone needs to find that, but I really don't know how to answer that. If I could answer that, I would win a crown. I don't know.
So coming back to Dr. Pratibha, can you recall?
Can I just add to that?
Yeah.
Just as an observation. So we see a lot of senior doctors, senior consultants at the hospital who are like 85, 90, stalwarts, in their heydays and peak times. But obviously there is a bit of decline in cognitive function and physical function, right? But they continue to work, they continue to operate simply because they don't know what else to do with themselves at home if they take time off from work. That is also not right. And that's what I mean about you need to develop some parallel hobbies, some ways that is going to take you forward when, as doctors, I don't think we know how to retire or when to retire. Right?
And ma'am, what's wrong in doing that?
What?
Why do you need to retire?
I'm not saying, but if you are probably, so I'm talking about making mistakes with their patients. Let me be very blunt.
Yeah,
right?
let me interrupt here. What Pratibha is intending to say is, as we progress in our career, we should shape shift. We cannot do at 80 what we were doing at 40. So we probably should move from practicing through or operating through muscle memory to training our residents, from seeing patients in the intensive care unit and putting lines in them to teaching residents how to do it, to develop guidelines. We have to transition slowly. There's no retirement. We have to just shape shift, that's all.
Absolutely. What Dr. Uma has said is perfect. And that is something, unfortunately, in our country, where doing exactly what she has said is because it's not financially as rewarding as seeing patients. We don't land up doing that. And that is something that we need to collectively develop as a future prospect for all of us aging.
I think financial knowledge for all the doctors is also very, very important, and that should be taken care of. Coming to that point, I will be asking both of you about the role of the institution, which institution or head of the departments can play in management of the mental health, the time, the mindfulness in residency. There can be something like we teach ABG or bronchoscopy in the department, something like that, Dr. Arjun.
I think
Pratibha first, then I'll ask Dr.
So let me give you an example. I mean, Dr. Talwar himself says, let's give that example. Metro is a very driven department. It's very focused. It requires a lot out of you. So yes, you're absolutely right, Kanishka. It makes what the person leading and how he or she sets the example is what shapes the people working there, especially postgraduates, right? I know there are people who in departments where they kind of indirectly teach their students to cheat, to manipulate, and those kind of things rather than doing hard work. So I think it's all definitely, most certainly, you're saying an absolute spot on thing is that how they see how their guides, how their consultants, how their heads are looking at patients, and of course, who is their guide and who is the head of department, who's controlling their destiny, so-called destiny for those 3 years is what shapes them. So you're absolutely correct in that.
Dr. Arjun.
Like everybody who comes out of Dr. Talwar's institute is hardworking, because we've had some of those residents come and work in Bombay, and you realize they're hardworking because that is what he expects of them, and he works so hard. So obviously everybody else he leads by example.
Kanishka, I fortunately did my MD from one of the most toxic places in the country, It's in Lucknow, and we were famous. Yeah, so this medical college in Lucknow is famous for, being toxic, and they take pride in being toxic. So I think the most important message for everyone as HODs or as being seniors, is to be a senior that you wanted then when you were a junior? Unfortunately in India, the secret of success is अगर आपको ऊपर बढ़ना है ना तो ऊपर वाले को नीचे खींच दो तो आप ऊपर बढ़ पाओगे. Embarrass someone, harass someone, make their life hell. रात को 12 बजे फाइल्स फाड़ दो. That kind of stuff. We were made to sleep in scabies infested wards, in beds during, रोज सुबह 2 बजे जाना है, 4 बजे वापस आ जाना है, तो यही, sleep in this ward where the bed is infested. So, these kind of silly things were done to us. And that is why I kind of pledged that I am never in life going to do this to anyone. And I think this is all of us as seniors, work life balance, one aspect of it is making your PGs or your juniors work for you. The other more important aspect is caring for them like family, caring for them like a mentor, like a parent. So be a senior that you wanted that when you were a junior. When your PG or when your junior colleague goes in for, wins an international laurel, when they win a scholarship, when they win something, that happiness should come from within you. When they do well clinically, when they do an intervention procedure that you don't know how to do, when they go abroad and when they represent, what you are all about, I think there can be no happiness bigger than that happiness. Doctors have very little petty egos, उसने मुझसे ज्यादा मरीज कैसे देख लिए, उसके अंडर कैसे भर्ती हो गया. And this is what leads to our downfall. At the end of it, being nice in life, not harming anyone, yet teaching them the importance of hard work, yet teaching them where life can take you if you are a thorough gentleman, if you are a nice person at heart. This is what work-life balance is, not just making them work hard, making them feel cared for, making them feel loved for, and actually genuinely loving them and supporting them. जब हम लोग जूनियर थे, अनफॉर्चुनेटली किसी ने सपोर्ट नहीं किया, है ना. हमें कोई नहीं सिखाता था कि आर्टिकल कैसे लिखना है. जब कोई जर्नल में कुछ छापने की कोशिश करते थे, these people wanted to be first authors and wanted to omit our names. Our MD thesis were published without our names being on it. Don't do that to your juniors. That's terrible, right? Be a senior that you wanted when you were a junior. That is what real, what real work-life balance or whatever you call it is.
And I completely second what Dr. Arjun is saying, because I usually meet his juniors around India when in the conferences, and everybody has to everybody says very good words about his leadership qualities and the way he treats them like a family. So definitely his topic is, of course, to blame the work-life balance, but he's a very genuine person. I mean to say, whenever I get to know from others about him. Dr. Uma, what do you have to say about this?
First of all, I have to say that the real Arjun emerged in the last talk which he gave.
Yeah.
See, basically, to paraphrase or put it in SMS language, he spoke about work ethic, work culture, work family, and mentorship, and role modeling. I mean, our youngsters may not understand these terms, but I have to say I've been fortunate to have excellent mentors and role models, the likes of Dr. Jindal, Dr. Dheeraj. So I automatically behave that way towards my students. But I do know that there are toxic work cultures, and I know of the college you're speaking about, Dr. Arjun. Despite all that, if you are able to role model and lead your students well, then hats off to you. So it is about work ethic. And another thing is, with the present generation, you cannot pull off an in my time. They don't listen. हमारे ज़माने में ऐसे होता था. They don't care because they are an instant generation. So the only way to influence them is by role model.
Yeah.
And
Absolutely. I think the whole world is changing so much. It's becoming so instant oriented, that everybody wants instant results. But yes, being a good role model is what will help.
I think Dr. Arjun said a very, very important point. I'm saying very important because I completely believe in what he said. अगर आपके साथ ऐसा हुआ है, so you cannot make it right कि मैं भी ऐसा ही करूंगा. you have to end the chain over there कि चल ठीक है मेरे साथ ऐसा हो गया बट आई विल मेक श्योर कि मैं किसी और के साथ ऐसा अब आगे पास ऑन नहीं होने दूंगा सो दैट विल बी ओनली चेंजिंग द होल सिनेरियो बिकॉज यू विल बी द पॉइंट जहां पे वो चेन रिएक्शन बंद हो जाता है एंड ऑफ कोर्स पीपल विल फॉलो यू एंड दे विल ऑल्सो ट्राई टू बिकम अ बेटर पर्सन एंड help you in all the way as a leader and professional should. So moving on to my second last question to both of you, is it possible that the term work-life balance is misused both by those avoiding responsibility and those glorifying overwork? So where is the middle ground and is it being misused or can be misused? Dr. Pratibha.
Yeah. So absolutely it is being misused. I think one of the prime examples it is being misused by, as Arjun has said, are people in training. Okay? Because now whatever laws that are also coming out, even in India, which were not there much earlier, but now there are regulations for people doing post-graduation about their work hours. So they are not realizing that first of all, there are many more students. The kind of like what work used to be managed by 2 or 3 residents is now being managed by 8 residents. So already their exposure is less as compared to the number of patients that were being seen in the ward, all those kind of things. So they are not realizing that they are not going to probably have as much experience by the end of 3 years simply because they're not lining up seeing that many patients or seeing that many emergencies. So it's a very individual thing. You have an 8-hour duty, yes. But if you have a patient in the ward that is interesting, it's an individual thing that you should take that effort to go and see what is happening to that patient, right? It's like saying, okay, fine, my 8 hours are up. Law says that I don't have to work for more than 8 hours. If I was doing night call, I don't have to attend daytime duty. That means you miss out seeing interesting patients. So they're eventually harming their own selves. That's definitely there. That your work-life balance is something that is misused by people in training, people who are working under somebody.
So, Dr. Arjun?
You already know my comments on that, and I will go overboard and I'll say something which I don't want to. But people misuse it all the time, and if I could have it my way, I would, but I cannot, unfortunately. But yeah, people do misuse it all the time, and I believe in calling a spade a spade. You cannot misbehave with anyone. You cannot be rude to anyone. You have to be gentle, you have to be good with anyone, but you at the same time you cannot let a PG take leverage of you just because they're lazy, just because they don't want to work. Because at the end of it, we are not IT professionals, we are not engineers. It is life at stake. If a PG is on call and if he's supposed to see the CT scan of a patient and report to the department, he has to do it. If he has to report an ABG, he has to report it. Saying I cannot do it just because my duty is over and those NMC hours and whatever has been prescribed is over, medicine unfortunately does not work this way. So you need to be good towards your juniors, but at the same time you need to understand, you need to make them understand that this is human life at stake, and you just cannot cut slack. It's not possible.
So I'll ask Dr. Uma ma'am, where to find the middle ground?
No, this is something like firm parenting. You set the ground rules and people have to follow it. Work again is like a family. It's a team of people caring for patients. Whereas in a family, things are stable. This is like a stormy sea in a hospital. So I think even in our own unit, we don't allow anyone to cut slack, but it is not necessary to use harsh words to drive home the point. But repeated sessions where we drive home that this is how our department works and this is the work culture. If you like it, you stay, otherwise you leave is the mantra we follow. I think we have to do it because like Arjun was saying, we are not dealing with machines, we are dealing with human lives. And there is no opportunity for mistake at all.
Very perfectly described, ma'am. So we have a lot of questions from the audience, but I'm going to take two. The first one is from Dr. Jay Prakash Rai, Bihar. He says, what resources are available to support pulmonologists' mental and emotional well-being? Dr. Arjun?
I don't know of any official sources. I'm really bad at all this. But I think going out with your friends on weekends, having a great time with them, a
I think more
little
about
bit of alcohol has
No,
never hurt anyone.
I think
Little
it's
bit.
about the,
Being there out with your friends, enjoying life is what is required. Travel the world, do what makes you happy. I don't know if any official response would be beyond my wavelength, anyways. I think just having a good time with your friends, your family, going out every once in a while, traveling the world, doing what you know you like. If it is dancing that you like, go dance. If it is swimming, if it is going to the gym, if I don't go to the gym every morning, my whole department knows because I'll be shouting at them, throughout the day. So whatever
I think we,
makes you any resources available. I'm really bad at this.
okay.
Yeah,
So,
in this
yeah,
context, yeah, NEGM has a center on work-life balance. There's an NEGM career center for those who want to go and read up. It cannot be directly applied to Indian settings, but there are a lot of carry-home messages there. I'll put it on the chat window for those who are interested.
thank you, ma'am. Dr. Pratibha, I think I will have to ask this question to you because this question is asked by Dr. Saurav, Haryana, Faridabad. I know, I think he works with Dr. Arjun, so it will not be nice to ask him because they might be having this conversation every day. So, in a country like us in India, where there is a cutthroat competition, how can we have the luxury of deciding how much we should work? I think Dr. Pratibha, uh,
Is not there, but I'll answer that on behalf of Saurabh Pahuja, one of the people who
yeah,
starts work at 6 a.m. and doesn't stop working. So you, anyways, whether or not this luxury is available, you are not going to avail it. So you have no right to
Dr.
ask this
Pratibha is back.
question.
Ma'am,
Sorry, there was a call from the hospital.
yeah, okay.
मैम ये
So,
कैसा वर्क लाइफ बैलेंस है आपका?
Don't ask.
Doc,
Tell
Dr.
me.
Dr. Saurabh Pahuja from Haryana, Faridabad, wants to ask that in a country like us where there is a cutthroat competition, how can we have the luxury of deciding how much we should work? If you work less, then you might be out of the competition. If you choose not to go to the conferences, then you will out of the limelight. He mean to say, I think that only that if you don't being shown also, or maybe you're not working, your opportunities decreases. So because of the cutthroat competition, what do you have to say, Dr. Pratibha? I think, ma'am, you got the question.
You're talking to me?
Yeah, I was
Sorry.
talking the whole.
Sorry. Yeah. So, no, I don't think it is necessary. Dr. Uma has already said that you need to decide. You know, we could be going to conferences every weekend, but at some point, if that is working for you, it's fine. But at some point, it will definitely stop working for you because you will realize that you're taking away from practice. You're taking away from just managing time for yourself. Forget your family or other extended stuff. All of us need some rest time, right, and recuperation time. So that doesn't happen if we are every weekend. If you're through the week, you're working 9 to like 8 to 10, and then on weekends you're traveling for a conference. There is definitely going to be a time where it's going to start feeling that no, this is not what I want. But what
Okay,
you're
so
saying about, so it's about, see, there, if you're talking about FOMO, you could feel FOMO with anything,
yeah, so
right? There is no limit to feeling FOMO. Like I could feel FOMO about the purse the lady next to me is carrying, but that doesn't mean, I mean, so it's a very individual thing. So as I said, it is about balance within yourself. What balance you are finding for yourself. You have to give up some things to get some other things. You can't have everything in life, right? But you
so we
have
are
to be balanced and you have to be mentally and physically balanced about it. That's all.
So I think Dr. Saurabh got the answer. So we have come to the end of this International Web Symposia. So before we end, what message do you all want me to give to the audience? I'll start with Dr. Arjun.
Work hard, yeah. Your kids, you need to learn. Work-life balance does come in, but it should come in after you've learned your stuff well. Work hard. And that is the key to be successful in life. And a more important message to the seniors out there, be gentle. These are our own kids. Treat them like you would treat your own children. There's absolutely no reason of being harsh and guide them, love them. And that is when they would put their best foot forward. And so it goes both ways. It's both sides that really need to open up, reciprocate, and love each other.
Dr. Pratibha.
Yeah. So I think uh, my closing remarks would be, I'm not saying that you slack from work, but find a balance for yourself, right? Your balance will change when you are doing post graduation. There, your balance will be more towards work, and it should be more towards work. When you start practice, that balance again will be more towards work. But as you are settling down, you need to find your balance then, whether what is working for you as a person. As I said, what works for Arjun may not be working for me. Okay. And I'm not saying that one should think that because I'm not seeing 100 patients in a day, that means I'm not passionate about my work. No, I could be passionate about 25 patients I see. Right. So, but at the end of the day, you have to sleep well, you have to be happy, you have to have an adequate financial backing for maintaining your financial status and your mental well-being and your family's well-being. Also, you have to figure out what is keeping you happy. What was keeping us happy when we were residents is not going to obviously keep us happy now, right? During residency, having 6 hours of sleep was like, my God, I'm in heaven. The day you had 6 hours of sleep, it was like, I don't want anything more than this. But obviously, that was like 25 years ago. Everything has changed today, right? So, obviously, it's a continuum change. At this point in time, what is your balance that is making you happy? Sleep well at night, not be stressed, not be having unhealthy competition, not have jealousy. Your family is also happy with you, you're also happy with them. That is what is important. And your patients are, of course, happy with you. That is most important.
Dr. Uma, your closing remarks. Who do you think should win this debate?
No, there's no winning. I said some debates are not meant to be won. And during the course of discussion, we realized both of them crossed paths and reached a middle point. So that's just about it. One thing which I would like to say is that as medical professionals, we are aware of stress. There are many professions who are sweating it out without knowing this and who don't know these fancy terms like work-life balance. Our pilots, our soldiers, our defense, they're all working without knowing all this and throwing these fancy words. So it's time to get up and, do what you have to do while keeping your sanity.
So I think what I personally felt, the two messages, first was from Dr. Arjun, that while training, like Muhammad Ali also said, the greatest boxer, that I hated all the minutes of training which I did. So of course nobody likes the training part. So the training part, which includes the post graduation in our subject, that shouldn't be something that I will not be able to do this or that, or maybe this time limit is there, or I will not be available after 5. Maybe this was the message from Dr. Arjun. And of course, as you grow older, I think your body changes, your priorities changes, and we need to balance ourselves. There is no limit. If you do 100, there will be people who will be doing 120, 150. If you continue to match this competition, there is no end to this road. You have to understand what you need in life, and you have to understand your family. And it's a very individual thing, this work-life balance. You should know it, but of course, never try to misuse it, especially the residents. So with this, I have come to this conclusion of this International Web Symposia, and I'll be seeing you next month on the last Saturday, and it will be the grand finale of this 2024-2025 PAX International Web Symposia series, and we will be having the main conference on 15th, 16th, and 17th of August, that is Octane PAX, and again we'll be seeing another debate live, Pratibha Singhal versus Dr. Arjun Khanna, as said by Dr. Talwar. Till then, see you. Good night.
Thank you.